So today I'd like to talk about having a pinched nerve in your neck or pinching something in my neck. Most of us have experienced this. We're merging on the freeway and we turn our head to check, and when we come back and something pinches, we have a sharp pain in the side of our neck, and then maybe for a couple of days you can't turn very well to the sides. Sometimes you wake up with this. You sleep wrong, your pillow's at a weird height, and you wake up and you pinch something in your neck. Often if we just wait a couple of days, this will go away. But if it doesn't go away on its own in a few days, it may be appropriate to seek care from a physical therapist. What could be happening is that you're having a meniscoid entrapment. So fancy medical word. All it means is something in your neck, there's like a little loose piece of connective tissue, and it's getting pinched in one of the neck joints. So in our cervical spine, which is the neck, the bones are called vertebrae. Each vertebrae articulates or has a joint with the bone above and below it. Those joints that allow some of the rotation through the neck are called facet joints. When we turn to one side, like when we're checking to merge on the freeway or when we're sleeping with our head on a pillow that's too tall, those joints gap and open up. And if we have little frayed strands of connective tissue in our neck, they can get stuck in those joints. And then when we come back to a neutral position, it pinches. Another analogy would be like getting your fingers shut in a car door, but then what happens is essentially the ends of the fingers swell up so much that you then can't pull them out of the car door, and they get pinched over and over. That's what's happening to the connective tissue in your neck. So that little loose body is getting pinched in that facet joint, it gets inflamed, and then it can't come out, which is why it could persist for several days and not fix on itself on its own. So then what we need to do as a physical therapist is help calm down the muscles, because often the muscles will become tight and irritated, which means that the joint isn't allowed to move enough to let that loose body out. So we'll do some stretching and some massage to loosen those tight muscles. And then we'll gap that facet joint with some manual therapy techniques to try to get that loose body to come out. And then once we get it released from the joint, then your pinch will be gone and you'll go back to normal pain-free life.